In this video, we will know about entropion and its 5 types. What is entropion? Entropion is the inward turning of the eyelid margin, causing the eyelashes to rub against the cornea and conjunctiva. This condition can lead to discomfort, irritation, and in severe cases, corneal damage if left untreated. Entropion can be classified into 5 main types. 1. Congenital entropion. 2. Cicatricial entropion. 3. Spastic entropion. 4. Senile entropion. And 5. Mechanical entropion. Now, congenital entropion. Congenital entropion is a rare condition present from birth. It is often associated with other abnormalities such as microphthalmos, a developmental disorder where the eye is abnormally small. 2. Cicatricial entropion. Cicatricial entropion is one of the more common forms, typically affecting the upper eyelid. It occurs due to scarring and contraction of the palpebral conjunctiva, which can distort the tarsal plate. Common causes include trachoma, conjunctivitis, chemical burns, and Stevens-Johnson syndrome. 3. Spastic entropion. This type occurs due to spasms of the orbicularis oculi muscle, usually triggered by chronic irritative corneal conditions or tight ocular bandaging. Spastic entropion is most commonly seen in older patients and typically affects the lower eyelid. 4. Mechanical entropion. Mechanical entropion occurs when the globe no longer provides adequate support to the eyelid. This can happen in conditions like phthisis bulbi, a shrunken, non-functional eye, ophthalmos, recession of the eyeball within the orbit, after surgeries like enucleation or evisceration. At last, senile entropion or involutional entropion. Senile entropion is one of the most common types and exclusively affects the lower eyelid in elderly individuals. Its development is linked to factors such as 1. Weakening or separation of the capsulopalpebral fascia retractor. 2. Degeneration of palpebral connective tissue, allowing the preseptal orbicularis fibers to override the pretarsal fibers, and 3. Horizontal laxity of the eyelid.
Subscribe Smart Optometry for more video like this.